Hi, I'm Michelle Thompson. This is my postpartum assessment video. The first thing you would do before entering the room is, and when you get in the room, is do hand hygiene, wash your hands according to the protocol of the facility. Then you would check the armband of the mother, which I don't think this one has, and then ask the name and date of birth just to make sure you have the right patient. First, before you do the actual bubble heat assessment, you would do vitals. So I'm just going to pretend to do the pulse, the blood pressure, and counting respirations and looking at heart tones. So you're checking the pulse, and while you're doing that, you can also simultaneously check the respirations by looking at their chest going up and down. And you do that for a minute to make sure you get an accurate reading. And then after that, you can do a blood pressure. And normally I would have the patient sitting up. I just don't want to mess with the bed to try to get it, because that would take a long time. So you would check the blood pressure on the site on the arm that is least painful to the mother. So I can probably get this down here. So you just do the blood pressure. Okay. And then once you finish the blood pressure, we can take the temperature and you would do this orally as opposed to axillary on the baby, because this is an adult. And then once you find the readings, you can put that away. Then you would listen to heart sounds and breath sounds just to make sure everything's okay there. This might actually be easier to do underneath right here. Alright, I've listened to heart and respiration sounds. Then we can begin our bubble heat assessment. The first B stands for breasts, and you are going to feel and look at the breasts to make sure there's no signs of a clogged milk duct, pain, tenderness. All of this could be signs or just hinder breastfeeding, so you just want to make sure that the mother is comfortable. So you would make sure there's no heat or pain. And you'd also assess the overall pain level of the mother too during your vitals assessment. And then you look to see that the nipples are intact, there's no bruising or redness or cracking, because that can all happen and hurts the mother when they try to breastfeed their baby. So I've checked the breasts, they're intact, they're good, there's no signs of clogged milk ducts and no pain. The U in bubble heat is for uterus. So you would check to see the position of the fundus of the uterus, which is the top, and use a two-hand method. And it looks like this uterus is about maybe 1.5 to 2 finger breadths below the umbilicus. It's supposed to go down 1 centimeter per day after you deliver. And then while you're doing this, you could also teach the mother about the uterine massage. You would massage for 1 hour or 1 minute every hour. And this helps clot up the bleeding and stop the bleeding so it heals a little faster, since it bleeds out a little and doesn't clot by itself like a normal cut like on your skin would do. And you teach this to her too while you're doing it, because it's very painful and may aggravate her if she doesn't think that you're doing anything to help her. So you teach her that, you check to make sure that it's going down as it should. And then the second B for bubble heat is for bowels. You would ask when they last went to the bathroom and had a BM. Then you would assess bowel sounds to make sure they're active and working properly. And you do that in all 4 quadrants. And just make sure that everything is good there. Then this third B is for bladder. You would check for bladder distension and ask when they last voided. And then you want to teach them to go to the bathroom every 2 hours, because after you have a baby, since your bladder has more room to expand, it doesn't send the same signals as it would before you got pregnant or while you were pregnant. So they may not think they have to go to the bathroom. So you want to teach them to do that. And this is because if the bladder starts to expand and gets really full, it can move the uterus to tilt to one side, which would cause the bleeding to occur again and slow the healing process of that. So they want to make sure that they're keeping their bladder empty and as small as possible so that it can help the healing of the uterus as well. Then the L is for lochia, and there is 3 lochia. There's lochia rubra, which is red, lochia serosa, which is a pinkish brown, and then lochia alba, which is whitish yellow. And it's like the same pattern as a normal period. And the flow of it would be about the same, should be about the same consistency of a heavy period. So there's quite a bit of blood's normal as long as it's not filling a pad within an hour. So you got to teach them to check every hour to make sure they're not soaking a pad. And if they do that, they should probably go back and rest and do their uterine massage as taught, or they need to seek medical help if it doesn't stop pretty fast, because that's abnormal. And so you would check to see the amount that's on the pad right there. And it looks to be about 4 inches by 1.5 inches or so. So it's not soaking, that's a normal amount as long as it wasn't within like 5 minutes or something like that. And while you're doing the uterine massage, especially if you're laying down, you need to teach the mother that it's normal to have like a gush of discharge, because it could have been pooling there when you're laying down. And so it's not all coming out, like it's not all blood that came out at once. It's over a period of time that just pooled while you were laying down. And after you check that, you would give them a fresh pad, fresh mesh underwear. This stuff is torn up, so and we don't have any extras, so we're just trying to deal with what we have. And then you want to teach them that if they go from white to red again, that they need to go and rest, because that is a sign of too much activity. And you just want them to not be super mom, and to be able to help their baby, they have to make sure they're healing good too. So if it goes from white to red, go back to bed. That's another thing you can teach the mother. And then E is for episiotomy. So you would get the mother on her side, and this is a little hard with this mannequin, but I'm just going to get her on her side to look at her episiotomy, if she had one. And then if you don't have good lighting, just use a little light. You check RETA, which is redness, edema, ecchymosis, discharge, and approximation. So you just want to make sure there's no signs of infection, that it's healing good, that the edges of the skin are approximated, like touching each other, the suture is healing well. And then while you're down here, you want to check for hemorrhoids if they had it, or if there's any pain. If they should go away over a period of time, or at least dim down the severity of them. And then if they had an epidural, you also want to check the epidural site, because it's a relatively large needle. You just want to check for any drainage or infections or anything like that, complications. After you check the E for episiotomy, you can get the mother back on her back. And then the H is homicide. So you do this on both legs, and it's to check for, this whole thing is to check for DVTs and for any signs of preeclampsia. So you would check for any warmth, any redness, red streaks, anything like that. That could be a sign of a blood clot, which isn't likely if they're being good and active, but you just want to keep a good eye on that. And then you would do a rapid dorsiflexion, go up really fast, and if their calf flexes really hard, that can be a sign of preeclampsia. And while you're up here too, you do a slow dorsiflexion, and then you tell the mother to just let her foot plop as it would if she's relaxing. So if it goes down and just kind of flops down, then that's a good sign, that's a normal sign. You would do this on both sides, so you want to make sure the rails are up. So you check for any DVT risk, warmth, redness, same old, do the sign. And then the slow dorsiflexion is called a clonus sign. So you want a negative clonus. You don't want them to be positive for that. If they keep it really flexed, then that's a bad sign. So after you do that, you're just going to kind of look at the mother's mood during the entire assessment. If she was tearful, in a lot of pain, sad, alert, attentive, confused. And then you also want to assess her education, if she remembered everything you taught. So you have the going to the bathroom every 2 hours. You have the uterine massage, signs of too much bleeding, signs of too much activity. And this is all just to better help her take care of herself so she can take care of her baby. And for cesarean birth, I almost forgot that. I'll have to get this down. It's pretty similar to the regular assessment, but you would check the incision site for the Rita again to make sure that it's healing well. Usually the pad or that would be off within 24 hours. You would check if they had a folate catheter, any signs of infection, and if they have it out, if they void it at all. Usually all this is out within a day, so the IV site would be gone within a day usually. You just want to check for any infection signs on that too. And other than that, there is not much else to do other than asking the mother if there's anything you can do to help her out. And that is my postpartum assessment.